She is the current president of DCMS, and she is a thoroughbred Texan, born and raised in Dallas, a practicing gynecologist since 1998. Oh, before that. 1988, I'm sorry. And she graduated with a magna cum laude from Southern Methodist University with a Bachelor of Arts in Chemistry and Biology, and was inducted into Phi Beta Kappa. Upon matriculation from SMU, Dr. Fuller attended the University of Texas Medical Branch at Galveston. She did her MD there, and also awarded as the prestigious Hanbroke McGranity Award in Obstetrics and Gynecology. So in addition to having a passion for medicine, she is also interested in regulatory efforts. She is serving as the American Medical Association delegate, and also the Baylor Medical Center member of residency training staff, and the Department of OBGYN Residency Selection Committee, and among many other numerous non-profit and civic organizations. She is also a mother of 3 creative and successful daughters. With that, please welcome Dr. Deborah Fuller, the current president of DCMS.
Thank you all so very much. And I'm going to, a point of personal privilege. I heard yoga, so I underdressed for the day. And I get to hear, and everyone is in beautiful dresses and suits, and I'm like, you guys got to tell me how to dress before I come, right? I'd interpret, well, we're all going to be relaxed, and we're going to come in our Saturday yoga outfits. Next year, we're going to all come relaxed, dressed for a relaxed program. Right? Okay, so now you're going to hear a little bit about advocacy. And for the first time, I'm going to be doing what the millennials and younger generations, I'm doing this off my phone, so bear with me. Let's see if I can do it. So, good afternoon, and thank you for having me at this year's TIPS NEC Wellness Symposium. As mentioned, I'm Dr. Deborah Fuller, an OB-GYN in private practice at Baylor. I also have the honor of being the 2024 president of the Dallas County Medical Society. DCMS is very pleased to collaborate once again with TIPS NEC on this amazing program. It's truly a unique look at wellness and prevention. We, as physicians, do not have the opportunity to hear about these important messages often enough. Please congratulate yourselves on taking the time out of your lives to attend this program, to place even more tools in your physician toolkit to better care for patients and ourselves as well. I'd like to thank Dr. Ganji, Dr. Shetty, Dr. Gudagoli, and the entire TIPS NEC Executive Committee for their collaboration, and once again, inviting DCMS to partner with you on this symposium. I only have a few minutes to speak with you today, but in this time, I want to share an important message to encourage each and every one of you to be members of both TIPS and DCMS. It's important as physicians to actively participate in both these organizations as a means to advance your practice and the house of medicine. One of the most important roles we at the Dallas County Medical Society take on is to advocate on your behalf as fellow physicians with state and local congressional legislators across the Metroplex. We also unite with our colleagues from across the state at the Capitol in Austin to lobby for medicine as a whole. The ongoing threats to the patient-physician relationship that we're experiencing today have never been greater. And DCMS, guys, as the second largest county medical society in the entire country, has one of the strongest voices in the nation representing physicians. But we can only be effective if all of your voices are united with us. As the current president of DCMS, I've made it my mission to collaborate with as many interest groups as possible to work to advance physician priorities in the interest of improving our ability to provide the best possible care for our patients. But we can only do that if you join us in our advocacy efforts. In our partnership, I also strongly encourage our DCMS members who are of Indian origin to become members of TIPS NEC if they're not already. Your networking efforts, cultural connections, and outstanding programs such as this provide members with additional benefits that advance your practices and careers, as well as advance your community as a whole. Being a member of TIPS NEC ensures that your unique needs are fulfilled by your colleagues in medicine who share your priorities and points of view. Through the collaboration between DCMS and TIPS NEC, I hope to continue to see all physicians actively participate in efforts to advance our profession. There are too many important issues at stake for any physician to be standing on the sidelines today. We need every voice as part of the whole to ensure that issues that are important to each and every one of us are heard by those who can truly impact change. That being said, we gear up for another legislative session just a short 7 months from now to invite you to join us in building relationships with legislators through our DCMS PAC. Now is the time to bend the ear of lawmakers before the madness of the upcoming legislative session arrives. To accomplish this, we attempt to meet with every newly elected and re-elected legislator before the lawmaking sessions start next January. We not only meet in person, but we've gained ever greater ease of access to them by using virtual meetings outside our own clinic hours. If you're interested in working alongside us and participating in any of these efforts, please let me or one of our staff know, and we would be happy to have you join us for the conversations. Every voice matters. In looking at the legislative issues that are affecting us currently and what we see coming next session, there are a few items we at DCMS would like to highlight. The first that affects so many of us, Medicare cuts to physician reimbursements. In the last legislative session, the proposal for cuts was 3.4%, but then it was ultimately reduced to 1.25%, for which we were very grateful. But this still drastic cut of 2.15% is concerning, as it only continues to move physician reimbursement further and further backwards. As a member of the TMA-AMA delegation, I've personally traveled to DC several times to advocate against these cuts, to no avail yet. Disappointingly, nearly every other non-physician sector in healthcare has been reimbursed and seen reimbursement increases over the past 20 years, except physicians. We need to continue to educate members of Congress to move forward toward a sustainable growth model in Medicare physician payments if we want to ensure continued access to care for our seniors and other Medicare patients. In Texas, we're also preparing for scope of practice fights in the next legislative session. Allied personnel, such as the NPs and CRNAs, have already indicated that they'll be back in Austin advocating for independent practice. We continue to educate lawmakers about the fallacy of expanded access to care that is promised in these proposals made by non-physicians, and will continue to lobby for only physician-led care teams next year. Another issue that recently gained national attention is IVF. You may have heard about the case in Alabama that swept IVF-related care under the same ban as abortion. Fortunately, thanks to lobbying of citizens and physicians alike, the state legislature stepped in and created legislation to specify that IVF specimens were not defined under the abortion ban. This issue sparked a vigorous discussion across the country, including Texas, where physicians argued for a similar definition. Fortunately for now, the legislature and Governor Abbott have publicly stated their support for IVF, but nonetheless, we're wary of them sticking to their word So we'll be diligent in watching for any external parties seeking to reverse course when the legislature comes into session. Lastly, you may recall that during the last legislative session, there was a bill introduced that would allow unmatched residents to obtain a provisional medical license to practice in rural Texas under the supervision of a physician. This is a potentially dangerous situation that could adversely affect the lives of those in need of critical, capable, and experienced medical care. Thankfully for now, that bill was ultimately defeated, and we've recently become aware that the author, unfortunately, intends to reintroduce a similar bill in the upcoming session. At the recent TMA House of Delegates, there was a vigorous debate about the merits and dangers of such a proposal. Ultimately, the House of Delegates voted not to support an alternative pathway to licensure, and the TMA lobby team, your TMA lobby team, will use that policy to advocate in Austin next session. Alternatively, DCMS and TMA members continue to argue for more effective programs, such as student loan repayment, which incentivize fully trained physicians to locate to underserved areas. Now, these are just a few examples of the issues that are currently facing us. But please know, we are very aware that there are so many more. If you have any thoughts or concerns about upcoming policy issues that you're passionate to lobby for yourself, or if you simply want to learn more about an issue, please reach out to any of our team at DCMS. We'd be happy to talk to you and include you in our efforts. Once again, thank you for taking the time today to take part in this collaborative educational effort between DCMS and TIPS NEC. We will all benefit greatly from it. And once again, if you're not a member and would like to join us in any part of what we do, please visit our DCMS table. We would be happy to help you. Enjoy the remainder of your day. And I see our CEO at the back of the room, John Roth, and Sarah Donahue's out there. So please stop at our table if you would like to before you leave. Good.